Meningitis and septicemia are diseases that can affect anyone and can have devastating results. Meningitis is caused when the meninges, the lining around the brain and spinal cord, are inflamed. Septicemia is blood poisoning caused by the same bacteria that cause meningitis. The important thing to remember is that time is absolutely crucial. The faster someone can be treated, the better chance they have of surviving and making a good recovery. Meningitis and septicemia usually start with flu-like symptoms such as fever and vomiting and feeling tired and unwell. If someone has meningitis and septicemia, they'll become very ill very quickly. Other symptoms include shivering, rapid breathing, cold hands and feet, joint and muscle pain, stomach pain, sometimes with diarrhea, drowsiness and confusion, severe headache, a stiff neck, a dislike of bright lights, and a rash anywhere on the body. Remember that these symptoms may appear in any order, and some may not appear at all. You can have septicemia without any of the meningitis symptoms. Meningitis and septicemia can affect anyone of any age, but most cases are in babies, young children and teenagers. Some of these symptoms are harder to notice in babies because they can't tell you how they're feeling. But there are specific baby symptoms like a tense or bulging soft spot on the head, blotchy skin that gets paler or turns blue, refusing to feed, being irritable when picked up with a high-pitched or moaning cry, a stiff body with jerky movements, or else being floppy and lifeless. The rash may not appear right away either, but if someone has a rash, here's an easy way to check if it's a meningitis rash. Take an ordinary glass tumbler and press it onto the rash. If the rash doesn't fade, and you can clearly see it through the glass tumbler, get medical help immediately. In its early stages, the rash might fade, so keep checking. The rash can be harder to see on dark skin, so check for spots over the whole body, especially on paler areas like the palms of the hands, the soles of the feet, and the abdomen. Also check inside the eyelids and the roof of the mouth. Parents know their children better than anybody else, so trust your instincts. Whether or not there's a rash, if someone is seriously ill and getting worse fast, they will need medical help. The sooner these diseases are recognized and treated, the better the chances of making a good recovery. That's why it's important to know the symptoms of meningitis and septicemia. The two main types of meningitis are viral and bacterial. Although viral meningitis can be very nasty, it's not normally life-threatening, and most people will soon make a full recovery. But bacterial meningitis and septicemia can kill in hours and can cause disabilities like deafness, brain damage, and the need for amputations. Vaccines provide excellent protection against some forms of meningitis and septicemia, but can't protect against all of them.